Hello, welcome to the FMLM podcast. My name is Angus Waite. I'm the Head of Engagement and Innovation at the Faculty of Medical Leadership and Management, and I'm really pleased to introduce this podcast, which features a discussion between Peter Lees and Peter Homa. Peter Lees, as I'm sure you'll know, is the Chief Executive of FMLM, and he'll be discussing with Peter Homa what lessons we can learn from his long career working in leadership positions within the UK healthcare system. Peter Homa is the current Director General of Defence Medical Services, which organise all medical, dental and nursing services within the British Armed Forces. This podcast was recorded in May 2020 and, as I'm sure you would have guessed, was recorded remotely, so just bear with us with any small issues you might find with the sound. So you'll hear more from me at the end of this podcast, but for now it's over to you, Peter Lees.
Thank you very much, and Peter Homa, thank you so much for your time on this podcast. I'm delighted to be doing this interview on at least two levels. Firstly, the Armed Forces has played a significant role in FMLM since we started the organisation back in 2011. Indeed, Air Marshal Paul Evans sat on council during his tenure as Surgeon General, and of course we're delighted he's now the Medical Director of FMLM, and a very strong relationship continues with the Armed Forces. Peter, of course, you and I go back a very long way. I suspect further than either of us cares to remember, so I didn't add up the years when I was thinking about this earlier on. But I've always appreciated your wisdom and also seen you as a very strong advocate for medical leadership. And it's that wisdom that I guess we want to tap into today in these remarkable times. And you have obviously a vast experience of leadership and management within the NHS and now within the Armed Forces. Could you just give us a brief thumbnail sketch of that?
Yes, thank you. And very good to join you, Peter. And if I could reinforce the very strong bond between the Defence Medical Services and FMLM, and it's one that I would like to see grow in strength. But in terms of my background, briefly, originally I was an economics graduate at Sussex University during the mid to late 1970s, where we occupied everything apart from the lecture theatres, time of student tumult. I then, after graduation, I embarked upon the most useful training I could ever imagine to become an NHS Trust Chief Executive. For several months, I was a general, then an operating department porter at St James's Hospital, Balham, South London. And I learned a huge amount about the many contributions that combined to provide high quality care for patients and looking after loved ones, and of course caring for staff. And then with my then girlfriend, who became my first wife, we embarked on a 9-month poor couple's grand tour around Asia. And it's fair to say I grew up during that time, visiting Nepal, Bangladesh, some remarkable locations with some deeply troubling poverty. I then returned to the UK, was self-employed as a picture framer, painter and decorator and non-HGV agency driver for 2.5 years, essentially to enable me to do some rock climbing, which was my passion at the time. And then after that period of time, I realized I could afford a girlfriend, a car and a stereo, but not all three. And then applied for a number of graduate management training teams, was absolutely delighted to get on to the National Administrative Training Scheme for the NHS, which is now the General Management Training Scheme. I had the privilege of a range of different jobs across the NHS at local and national level. I had the privilege of serving as a chief exec in 5 different organisations, accumulated something in the order of nearly 30 years chief exec experience as part of a nearly 40-year career in healthcare management. In 2006, I joined Nottingham University Hospitals as the chief exec to help merge Queen's Medical Centre and Nottingham City Hospital, and left in 2017 to become the chair of the NHS Leadership Academy. And then in August 2019, I had the privilege of joining Defence Medical Services as the Director General, in effect the Chief Executive of the Defence Medical Services, which, as you described, is responsible for the provision of occupational health and healthcare across the globe for all of the UK's serving personnel and their families. And I'm delighted to join you and to contribute to the podcast series. Thank you.
Thank you, Peter. That makes you uniquely qualified to pick up my next question, which is related, obviously, to the fact you've had all that extensive experience, life experience, but also a huge amount of experience in the NHS. And I know you've paraphrased that quite significantly because there were many other significant roles that you held within the NHS. But now, as you've moved to being the head of the Defence Medical Services, it'd be really interesting to hear your initial observations of leadership in the Defence Medical Services compared with your experiences within the NHS.
Yeah, delighted. I think the base note, Peter, is when comparing the NHS and Defence Medical Services, there are far more similarities than there are differences. The similarities include absolutely dedicated people, whatever their calling, whether they're a clinician or someone in support of clinical colleagues, absolutely dedicated people. Both are large, complex organisations with all of the resident opportunities and challenges that such organisations present. Both operate in the public eye. That's no more true than during this national challenge of COVID-19. And there's a huge desire on behalf of everyone within both services to continuously improve the service that are provided, often bumping up against some constraints, sometimes money, sometimes convention. And also a very strong bond between the two is that of empowerment, a desire to make sure that those closest to the delivery of patient care have the greatest opportunity to influence what and how we do the work that we do. And the final similarity that occurs to me is that of values, the importance of understanding the values that bring colleagues into their respective calling, whatever it is, and to make sure that the organisation that has the privilege of those individuals within their employ, respecting and building upon an environment that will value the values and commitments that individuals bring. In terms of differences, there's clearly the two cadres of military and civilians who work very closely together, but it's a very different set of arrangements compared to the NHS. The other aspect which is particularly striking in the military is the relatively short lengths of stay of personnel within the military in their particular assignments, and sometimes that can be as little as 2 years. Rarely is it longer than 3 years, and that can lead to discontinuity. And there are approaches we need to adopt to make sure that, particularly involving large-scale change, that we don't find a discontinuous program of work. We need to make sure that we have a continuous determination to improve the service that we provide. Clearly, within the Defence Medical Services, we operate globally, sometimes in very remote, very isolated settings. The other aspect, which is particularly strongly featured in the military and less so in the NHS, is deference to grade and rank, where individuals will be described as their rank rather than their role. That took me some adjustment. And the other couple of differences in the military is, firstly, the clarity of written work is absolutely superb in the military. And I confess, very often personally being responsible for business cases that one measured by kilo rather than page number. And whereas in the military, colleagues are very skillful at conveying a wealth of information in a very, very pithy form, in a common framework that is well understood. And I think there's a lot for colleagues in the NHS to learn from that. And the other aspect I would observe respectfully is, in the military, meetings start on time, as opposed to the ragged start, which very often I contributed to in the NHS, where individuals sometimes achieve a just-in-time arrival at meetings or just too late. Whereas in the military, when a meeting starts at 9 o'clock in the morning, it jolly well starts then. those would be my initial reflections, Peter.
Well, thank you very much. And gosh, there's a lot of information there. I think it was also very helpful in debunking a myth I've heard so many times, that a very simplistic view of life and leadership in the military has been simply about shouting at people. My experience is it is infinitely more sophisticated than that. So thank you very much for that. I wanted to change tack a little bit. One of the things that's cropping up a lot at the moment, both from, I think we're hearing a bit in the news about this, but especially from colleagues in the NHS, at the speed that changes are being able to be made at the moment because of the crisis, compared to some of the normal ways of working. And you've alluded to some of those in your last comments. How does the military tackle issues in response to identifying the needs in a conflict or a humanitarian situation?
Yes, thank you. And I've learned a huge amount already from colleagues within Defence Medical Services, and indeed the wider Ministry of Defence, on precisely this. And if I can just make a couple of introductory comments and then address your question full on. It is the environment that we're in with the COVID-19 challenge, which is very similar to similar epidemics, be it Ebola, SARS, and indeed conflict, where there is a singular purpose which unites the organisation and frankly cuts out some of the guff, the entropy that gets in the way of fast decision making and fast progress. And across Defence Medical Services, and I think across the wider MOD, there's a real appetite and desire from all of us to make sure that we understand what is it that we are able to do during times of conflict, in this case confronting COVID-19, that enables us as a single force to make accelerated progress that we can hardwire into the way in which we work in the future, as opposed to snapping back to the status quo ante. So that's a very important mindset. And examples being, and I know colleagues within the NHS have got some superb examples alongside the one from Defence Medical Services. Within Defence Medical Services, we introduced e-consulting and video consulting within a handful of weeks across the world, compared to what we anticipated would be a programme of implementation that would take over a year. And I know NHS colleagues have done something very similar. There's a huge amount from us to learn there. And I've learned already from colleagues within the military that conflict, adversity, war, sadly when it takes place, creates an environment within which innovation at accelerated pace is achieved and necessary. Many examples from Camp Bastion, which have transferred from the military into routine NHS care, which you'll be familiar with as a surgeon, Peter. With the COVID-19, the emphasis is particularly on medical advances, and there are many examples of that. And the mindset that military colleagues enter in is, of course, do no harm, but to look for areas in which we could accelerate improvement. The military have a range of planning tools to enable a structured approach to developing a deep understanding about what can be done to improve patient care, and then rapidly applying those, obviously making sure that all the necessary tests in terms of patient safety are observed. And what we have found across Defence Medical Services, with some tremendous innovation from the Army, the Navy and the Air Force, and indeed other colleagues that support all three, is a way of quickly synthesizing the many good suggestions and ideas, bringing in global expertise to critique those, to prioritize those, and then to implement them. Rich Withnell, a very senior colleague within the Defence Medical Services, has helped with others articulate how we go about that in a way that has translated into far better care and to those we serve. Thank you.
Thank you very much. Of course, Rich is a Defence Medical Services representative now on the council, so I'm delighted to hear that. Thank you, Peter. That's brilliant. You won't be surprised that resilience is a topic that I wanted to get your views and advice on. And I've been very encouraged in recent weeks by a clear focus in the NHS to recognise the need for, I don't know if psychological support's the right word, but support to colleagues in the NHS through this really, really difficult time. And I'd like to think FMLM's playing its part in that with a very simple initiative we've called Safe Space Conversations. But it would be really, really good to hear from you, because I mean, the military must be absolute experts in this, and any lessons that we have to learn from the military again in conflict. But also, I think we forget a lot that we see the military as all about conflict. But I mean, you've already alluded to Ebola and so forth, but the military plays a huge and very modest role in terms of the publicity it gets in humanitarian operations. So I just wondered if you could give a few reflections on resilience.
Yes, thank you. And again, I've learned a huge amount from colleagues in the military on this. And as you say, there's a strong tradition built on adversity in previous conflicts within the military to better understand how we support those within the service in terms of resilience, personal as well as organizational resilience. And the work of Michael West, Amy Edmondson in articulating psychological safety and the ability for individuals to feel safe to talk out, to speak truth to power, is something that is evident in many areas within the military. And there's some very strong examples of a programmatic approach, for example, not only to rolling out particular tools and techniques, mindfulness being amongst them, and a range of other techniques to help encourage personal awareness in terms of mental health and well-being, but also supported through a program of empowerment. And that's an area within Defence Medical Services that we are going to place particular emphasis on over the next several years. And the very strong ethos of teamwork is abundantly clear in the military, as indeed I know it is within the NHS, where individuals will look out for each other, and that I think we've become increasingly skillful as individual members of teams to ensure that we're looking out for the well-being of other colleagues as well as oneself, and that's a very helpful approach. There are a range of other aspects that I know are very well practiced within the NHS as well as some areas within the military, and that's, for example, Schwartz rounds, which provide a safe opportunity for a team to decompress after perhaps a particularly challenging episode of care for a patient or another aspect of the care that's a provision. So I think over time what we've seen within the military is growing expertise, a growing explicit recognition that the mental health and well-being is as important and necessary facet as physical health and well-being, and that combines to make sure that we are increasing resilience for those within Defence Medical Services that we serve. And there's always more to be done. Always more to be done. Thank you.
Very, very true. Very true. Thank you for that. The last thing I wanted to touch on with you is that we've all seen the pictures on the news around, for example, the Nightingale Hospital with the military involvement. And again, very humbly in the background, not making a song and dance about it, but obviously playing a fantastic role. And we hear about MACA. You see, I'm now into the jargon, but the military aid to civilian authorities. And I wonder if you could just give us a few insights into the sorts of collaborations that have occurred throughout the COVID pandemic, and particularly around the delivery of healthcare, because I sense we all really value that partnership.
Yes, thank you. And within Defence Medical Services, and I'm sure across the wider Ministry of Defence, we are very pleased to provide as much support as we possibly can through, as you described, Peter, military aid to civilian authorities, so-called MACA activities. And we have literally thousands of our personnel supporting the NHS in a variety of ways. Of course, we have many hundreds of our personnel actually embedded within NHS organisations, contributing frontline clinicians, doctors, nurses, scientists, physiotherapists, and others, making a material difference for NHS direct care. And also within the broader effort and the posture, as you rightly described, Peter, that we and the wider MOD wish to adopt is that of humbly supporting the NHS, because clearly our NHS colleagues are taking the principal heavy load, and our role is to help and support in whatever way that we can. And there are many, including the very, very impressive command, control, and logistics expertise that the military have, which, as a civilian, is awesome. The ability to help support and design creation of the Nightingale hospitals literally over a handful of days, from a conference centre into a viable unit capable of accommodating thousands of patients, is absolutely extraordinary, and that is substantially based on expertise in terms of logistics that the military has been very pleased to help support. The provision of ventilators, infection prevention and control, health informatics, and critical care patient transfers, including across London, are areas in which we've been very pleased to provide support. And of course, area medical evacuations of UK personnel from around the world. And very, very importantly, the rapid assimilation of research and clinical innovation, as I mentioned briefly in one of my earlier comments, where we have made sure that we expose ideas and suggestions for improvement to world-class critical examination, and then rapidly translate those that satisfy the necessary tests into ways in which improve the quality of what we can do for those we serve in the NHS and more broadly across the Defence Medical Services activity, which of course, as I mentioned, is a service across the world wherever we have serving personnel. So it's a very strong bond between the military and civilian activities. We're delighted to have reservists join our number, and if I could use this opportunity to encourage anyone who might be interested to explore the possibility of joining as a reservist. It's a fantastic, fulfilling, and rewarding, and appropriately challenging program of experiences, and it's a very good way in which, in our case, Defence Medical Services and the wider MOD can help add additional value and benefits to those we serve, and that's the wider population of the UK. Thank you.
Oh, thanks very much, Peter. I mean, that's been really inspiring, and I guess it was awesome to see the speed at which the Nightingale Hospital and all their sister organisations across the country have been established. But also, I think it's a point that I can perhaps make more easily than you. I think it's just incredible to hear all the other stuff that's going on in the background. And back to that point you made about humility, that we don't, I sometimes feel that perhaps you don't get the credit that you deserve. But I know that's a position that that you hold very dear, and thank goodness that we can draw on that at these rather dramatic times. So unless you have any final comments, Peter, which of course we'd be delighted to hear, I'd just like to thank you very much indeed. I've learned a huge amount, and I hope that we can continue the strong bond and grow the bond between FMLM and the armed forces. And I just think we've been so fortunate to get your unique perspectives on the whole of your time in the NHS, but also now this critical role that you hold in the armed forces. So on behalf of FMLM, thank you very much indeed.
Peter, thank you. It's a great pleasure to contribute, and I very much look forward to us further strengthening the bond between the FMLM and Defence Medical Services. With very best wishes to you all. Thank you.
Well, thank you, Peter Homa. What a fascinating discussion that was. I know a lot of our members and fellows, both armed forces and not, will have really appreciated your insights. You both mentioned Ebola, and Rich Widnall's name came up a few times. Rich Widnall wrote a really interesting article for FMLM a few weeks ago. It's called "The Longer You Can Look Back, the Farther You Can Look Forward," in which he discusses the military's response to Ebola in light of the response we are all having to make to COVID-19. So I'd strongly encourage our listeners to check that article out. If you are interested in supporting FMLM and supporting your own leadership development, then do consider joining FMLM. You can find information about that at fmlm.ac.uk/join. Now, we have really enjoyed this initial run of FMLM podcasts. We are taking a break next week, so do remember to subscribe to FMLM wherever you get your podcasts. We will be creating more of them over the coming weeks, and we'd love to hear your feedback on the previous 3 episodes and any ideas you have for future content. Perhaps you're a member or a fellow and you'd like to be involved in one of these podcasts. Do let us know. You can email me at angus.waite, that's WAITE, at fmlm.ac.uk. So that's all for this week. Stay well and do look out for the next series of FMLM podcasts, which will be launching in a few weeks' time. Bye bye.